afternoon, and welcome to today's presentation, The Nuts and Bolts of MIPS Scoring 2017 Data Submission. My name is Valencia Harper, and I will be your facilitator today. At this time, all attendee lines are muted for this session to minimize background noise and distractions. We encourage your questions and input throughout this presentation. Please feel free to use the raise hand icon in your taskbar or submit questions and comments in the chat box provided. Today's presentation will include polling questions. We encourage everyone to participate as we value your interaction. Today's presentation will also be recorded and later uploaded to our Visions Delmarva PTN YouTube channel. You may find the link on the flyer included in the invite to today's webinar. Today we are privileged to have Cindy Eiseman as our presenter. Cindy is the Project Manager for Visions Delmarva, a practice transformation network working through the CMS Transforming Clinical Practice Initiative. Cindy has over 30 years of experience in healthcare, starting in the area of health information management and expanding her skills in areas of expertise to perform improvement, operations management, healthcare financing, and practice transformation. Cindy has been a CEO, COO, and Regional Quality and Operations Director with Health South, Kindred, and several community hospitals. Cindy is a native of Pittsburgh and graduate of the University of Pittsburgh and the Troy University in Alabama. I would now like to hand it over to Cindy to begin our webinar.
Thank you, Valencia, and welcome everybody. Welcome back to our Nuts and Bolts series. It's been a year almost since we did our last Nuts and Bolts presentation, and there's new information now regarding how we're actually going to submit data, and so we wanted to take this opportunity to share that with you. So we'll start out with our questions to run on, as we like to do. And our first question to be thinking about today while you listen to the presentation are, what are the options for my practice to submit Quality Payment Program, or QPP, MIPS data for the 2017 performance period? What are the important deadlines for QPP MIPS data submission? How can the QPP data submission portal be used to report the 2017 MIPS measures? And how do I set up EIDM access through the CMS Enterprise Portal? And while you may not know what that means at the top of this presentation, hopefully by the end you will be able to go out and get EIDM access so that you can access these important tools. So for our agenda, we're going to do a brief overview, very brief, of the Quality Payment Program, QPP MIPS. We're going to do an introduction and overview of the new QPP Portal, and we're going to review EIDM access through the Enterprise Portal. So first, for an overview, who's included in MIPS in 2017? 2017 is the performance year we just ended. It's the year we're going to be submitting data on. And the data that we submit for 2017 will drive your reimbursement in 2019. Those who are included in MIPS this year, or the QPP program, are physicians, physician's assistants, nurse practitioners, clinical nurse specialists, and certified registered nurse anesthetist. The slide also shows what a physician means, so it's really anybody that can say that they're a doctor other than a PhD. Who is not included in MIPS? So there were exclusion criteria for 2017. People who newly enrolled in 2017 as a Medicare provider, so brand new, not that you changed your practice or that your practice TIN changed, but that a provider's NPI was new, that provider would be exempt. Practitioners who were below the low volume threshold for 2017, that meant that either they charged less than $30,000 in Medicare Part B allowable charges, or saw less than 100 Medicare Part B patients in that year. You can check to see your eligibility on the QPP portal by putting in your NPI number, and it will tell you if you meet either of these criteria for the test period. This eligibility test period, if you look at the red note at the bottom, is based on two look-back periods, from 9/1/15 to 8/31/16, and then again from 9/1/16 to 8/31/17. If during either of those two 12-month periods you charged Medicare less than $30,000, in allowable charges, that's the value you use as allowable charges, or if you saw less than 100 Medicare Part B, not Medicare Advantage or managed care, but straight old ordinary Medicare Part B fee-for-service patients, you would be excluded from MIPS for this year. And then finally, people who are in advanced payment qualifying participants. So if you receive 25% of your Medicare payments, or 20% of your Medicare patients are paid to you through an advanced APM or an APM, an advanced APM, you would be excluded from MIPS because you would instead be reporting your information through that alternative payment model that you're involved in. In 2017, the MIPS score is calculated by adding together only 3 performance categories: quality, improvement activities, and advancing care information. 60% is weighted to quality, 15% to improvement activities, and 25% to advancing care information. That will give you your total score. Remember that the cost category is not included in 2017, but it will be included in the 2018 MIPS data. Important note, if you report no data for a category, you will score a 0 for that category. So let's say you don't submit any advancing care information data. You don't have an EHR and you're not going to submit advancing care information data. You just get a 0 in that category. So that basically 25 points that would be available to you are not available. But if you do an improvement activity like TCPI, or you put in all your quality data, it is still possible to get 75 points. Here are your deadlines, important for you to know. You have until March 31st to submit your data for 2017. That's the deadline that we've all been given. That's what we're working with now. I know you're probably saying to yourself, yeah, but that was last year's deadline for PQRS and it eventually got extended till May. It could happen, but we don't want to rely on it. So we want to make sure that you're doing all that you need to right now to ensure that your data is complete, that you know what methodology you're going to use, and we'll talk in a little bit about why submitting early and often could potentially be the better tactic for you. There's one exception to this. The CMS Web Interface or GPRO users, your submission window is January 22nd to March 16th, so you have a shorter window of time. But that only applies to people who are submitting data through the CMS Web Interface, often called GPRO. That's group reporting, and you would have to have registered for this prior to now. The registration deadline for using GPRO has already expired. This doesn't mean everybody who's submitting as a group. It only means those who use this very specific CMS Web Interface to submit their data. Okay. If you recall, in 2017, there are 3 ways that you can report data. You can do something called testing your pace. That means submit something. And when we say submit something, we just mean something, anything, one measure on one patient. You could submit quality measure data on one quality measure on one patient, and you would be okay. You could attest to, if you're a small practice, TCPI participation, which is a high-weighted activity. That would give you all the points that you need to test your pace. If you decide to test your pace and that's all you send in, you get a neutral or small positive payment adjustment. You're guaranteed no negative adjustment if you at least report one measure. Partial year reporting is the next option, and this was what a lot of practices are doing. For this one, you have to report at least 90 days worth of data. And by doing so, you would be eligible for a positive payment adjustment of some kind. No matter how you score, you will get some kind of positive payment adjustment by submitting data in all 3 categories, quality, improvement activities, and ACI. You can get partial year. Full year, same thing, except you're doing it for 12 months worth of data. Note at the bottom, non-participation in QPP will result in a negative 4% payment adjustment in 2019. That is guaranteed. It is a guaranteed 4% negative payment adjustment if you do not pick one of these methods. So if you don't at least test the pace by submitting one activity, you will get a 4% negative adjustment. So that test pace again, what does it mean? It means you avoid the 4% penalty and you have to submit a minimum amount of data. That would be one quality measure or one improvement activity or the base measures for advancing care information. That's what they consider one measure in each of the categories. For partial and full year reporting, you can report measures for a period of 90 to 365 days. The best way to earn the largest positive payment is to submit data on all categories. So your best chance of a higher score and therefore higher payment adjustments is if you submit quality data and an improvement activity and advancing care information data. Again, if you don't have an electronic EHR and you can't do advancing care information, you can take a 0 in that category, but you then want to maximize the points that you're getting in the other two categories. Positive payment adjustments up to 4% in 2017 are based on performance rates and not the amount of information submitted or the length of the reporting period. So if you look at your data and you look at a 12-month run of 6 quality measures and you're going to get, let's say, 40 points out of those, but if you only submit the last 90 days of the year because by that time you had improved how you were collecting the data and improved your practices within the practice, and so now that's worth 50 points, report only the 90 days. Get the 50-point score. It doesn't matter how many days that you're reporting for. It's all the same. The bottom line is what's the score. And a special note on quality measures. You can submit more than 8 quality measures. You will get full scoring and bonus points for the 6 highest scoring measures and bonus points, that is a typo, for any additional high risk or high outcome measures on your report. So you can submit more than the required measures. You will get points for any high risk or outcome measures that you report over and above the required. You do have to decide whether you're going to report as a group or as an individual. All MIPS categories do though have to be reported the same way. So if you're going to report your quality measures as a group, you must report your ACI measures as a group. If you're going to report your ACI measures as individuals, you must report your quality measures as individuals. You have to pick one. If the practice is an ACO, you have to do group reporting. An individual is one NPI assigned to a TIN. A group is 2 or more clinicians who have reassigned their billing rates to a TIN. Just because you bill as a group doesn't mean you have to submit your data as a group. You can bill as a group and submit your data individually. If you bill as an individual, you have to submit your data individually. So that's, obvious. So that's our brief overview. It's time for our first polling question. So Valencia, if you would like to launch that first polling question, that would be great.
Certainly. Our first question asks, for year 2017 that just ended, I plan to report a full 12 months of data, partial year, 90 days of data, one measure using the text-based option. I do not plan to report any MIPS data and will receive a 4% negative payment adjustment.
So if everybody would select their chosen one, and when we're at least at 75% of the respondents, Valencia, you can give me the results.
It looks like we have about 30% a full 12 months of data, and 70% say a partial year, 90 days of data.
And so nobody picked test your pace. Yay. All right, good. That's a positive. We like to see that our PTN practices are going for the gusto. All right. Quality submission methods. So we're going to talk about quality, then improvement activities, and then ACI, I think in that order. So these are your options for submitting your quality data. If you're reporting as an individual, you can use a QCDR, which is a Qualified Clinical Data Registry, a qualified registry, which only differs from a QCDR in that it doesn't give you real-time data throughout the year. It's simply a reporting mechanism. Directly through your EHR, if your EHR is capable of doing that. You could submit through claims, although if you were planning to submit through claims, you need to know that at the beginning of the year so that you are applying quality codes to your claims as you submit them. And then the last one is the QPP Portal, which we just added. Really, though, the QPP Portal is just another mechanism to do an upload of an EHR file, and we'll talk a little more about that when we talk about the QPP Portal. If you're a group, you have similar but additional options. The QCDR is still available, the Qualified Registry, EHR is available, administrative claims, which is a little bit different than regular claims, a CMS web interface, so that would be GPro, CAPS for MIPS survey, you can use a quality, the quality score from your CAPS survey if you're using CAPS, and then again the QPP Portal, but once again that's really just an upload of an EHR file. It's not a data entry terminal. The CAPS for MIPS survey does count as one patient experience measure. 5 other measures must be submitted using a different reporting method. So that's the only exception to the rule that all quality measures must be reported via the same submission method. You cannot submit 3 measures through a registry and 3 measures through your EHR. It's going to, everything goes in one group in total. So even if you decided to submit 6 measures directly through your EHR and then the same 6 measures through a registry, CMS is going to pick the highest score that you achieve. And again, we'll see that in a little bit when we talk about the QPP Portal. So all quality measures must be reported via the same submission method. As far as advancing care information goes, you have 4 options as an individual. You can attest to this on the QPP Portal. So you can actually go in using the QPP Portal and enter your numerators and denominators and then attest to their accuracy. That is not available to you for quality measures, but it is available for ACI. You can again use a qualified clinical data registry, you can use a qualified registry, or your EHR vendor can submit it directly. For a group, very similar, except you also have the CMS web interface if you're a group of 25 or more. For improvement activity submission, you have the same 4 choices for whether you're an individual or a group. Attestation, a QCDR, qualified registry, or your EHR vendor. One of those 4 ways should allow you to submit your improvement activities. Just a reminder that the improvement activity measure for TCPI PTN participants is IA_CC_4. So let's talk about the QPP Portal. This is the address for the QPP Portal, qpp.cms.gov. It's the place that we've already shared with you many times where you can go out and look up measures. It's where you can go and type in on the front page of this portal your NPI number to see if you're considered eligible or not. But it now has a new button on it that will take you to a secure portion of the portal where you can enter some of your QPP data. So, looking at the screen here, we can see what the QPP Portal looks like. Quality Payment Program, this is where you've been going to maybe look up your measures, the different measures. If you clicked on that, you'd get your different measures to pick from. APMs, if you're in an APM, you have your own tab. Stuff about the Quality Payment Program, including a resource. And then there's a sign-in. If you click here to sign in to submit and manage data, this is the screen that you'll get. And it tells you right off the bat, to sign in, you need to use your Enterprise Identity Management, or EIDM credentials. And you have to have an appropriate user role assigned to use it. You may have used these credentials in the past to log into the CMS Enterprise Portal and or to submit PQRS data. So, you're going to need this. It's the only way to get through it. And if you have never set up an EIDM account and got EIDM credentials, we will talk about that at the end of this presentation on how we're going to help you to do that. But so you would enter in your user ID and your password, and it would take you to a screen that looks like this. On this screen, you can see your TIN that you're tied to once you logged in, because you're tied to that TIN with your EIDM number. It's going to tell you that that's the TIN that you're in. And we had picked group reporting when we went through it, so we said we're going to do it as a group. And it lets me pick whether I want to submit quality data, advancing care information, or improvement activities. Let's say we picked quality data. These are your two choices if you pick quality data. If you've registered for the CMS web interface, you would also have that option. So you'd have 3 option tabs listed here. But we did not in this practice, and so our only 2 options are either to upload a data file of our 6 measures, or if you're working with someone else to do it for you, a registry, your QCDR, your EHR vendor, you need to contact them and let them know that you'd like to submit data. I realize if that's the option that you're using, you're already in contact and working with them, and they will take charge of this responsibility. But it's just a reminder that you don't have to do this yourself. You can have a vendor do it for you. If you were to pick on this screen, File Upload, this is what's going to come up. And this in yellow is really important because it explains what you're going to be able to do here. This upload tool accepts properly formatted QPP format and QRDA3 files. Any files submitted are received and calculated immediately. The most recent file uploaded has the potential of clearing out the previously submitted data. So, you're not going to get a screen where you can enter in the measure number and your numerator and denominator. All you're going to get is the ability to drag and drop to upload a QRDA3 file. A QRDA3 file is a relatively well-specified and complicated file format. It's an Excel spreadsheet in its base form, but the requirements for how it's set up are very specific. And generally speaking, your EHR would have to create that QRDA3 file for you. So, some of you have experience with PQRS where that's exactly how you submitted your data. You would work with your EHR, make sure all your data was in. Once you were satisfied that it was good, you'd run a report. It would download or dump the data into a QRDA3 file, and then you would upload that into the PQRS system. It's very similar to that previous technology. If you're not a person that's ever done that before on your own, you have the option of certainly talking to your HR vendor and seeing if they can create the file for you. This is a detailed file. It isn't just the numerator and denominator for each measure. For example, if hemoglobin A1C is one of the measures that you were sending, what that file would include is actual patient-level data on all of your diabetic patients who meet the denominator criteria, showing whether they meet the numerator criteria. So it's a large data download. It is not a summary of data. So again, at the bottom of the screen, I put you cannot enter individual or group numerators and denominators here. All you can do is upload a file. However, if you can do that, there are advantages to it, because once you upload that file, it is going to automatically calculate how you scored on that measure based on the most current benchmark information in the system. So in this example practice, antidepressant medication management was one of their measures. It's measure ID 009. They scored 93.66% and got 11 points for that measure on a scale of 1 to 10. And you say, well, how did that happen? Well, you click on that measure and you come down to the box on the bottom. And this is telling me how that all happened. 93.66, 11 points. Here's the benchmark data. They are benchmarked up here in the final percentile, and they got 10 points for that. In addition, they got an extra bonus point on this measure for reporting it using what's called end-to-end reporting. End-to-end reporting basically is sending raw EHR data, detailed patient-level EHR data, as your measure submission. So the portal, because it only accepts that patient-level detailed data, is considered end-to-end EHR reporting. So if your EHR is capable of creating a QRDA3 file for you to upload, there's an advantage to having it uploaded, because you can see all of this information on it and you get that extra point. So that's a real bonus to this, being able to see in real time what's happening. I will tell you, though, it's not only you uploading the data that would allow you to do that. If your EHR or registry, as soon as they upload the data, it also will appear here. And so you'll be able to see, after they've uploaded it, generally speaking in real time, the same level of information on each of your measures so that you know what's making up your score. This is one more level. This is a dashboard. So this is showing you that this practice not only uploaded their EHR data, and they did really good on it. They scored 60 out of 60 for their EHR, the data they uploaded through the site. But a registry, they also had data submitted through a registry, but for the registry, they only scored 52.3. If you enter data using the portal and through a registry, you can compare the results of each. Or if you submit data through your EHR vendor and a registry, you can compare the results of each. CMS will only use one submission method. It's all or nothing, but they will select the one with the highest score. So it doesn't hurt to submit data multiple ways if you have that opportunity. It doesn't hurt to submit data multiple times. If you submit your data the first time and you look at your dashboard and you go, well, that doesn't quite seem right, and you dig into it a little more and you realize that something was left out, you can update the records however they need to be, and then you can upload the data again. You can upload your data yourself, through your EHR, or through a registry, technically, as many times as you want between now and March 31st. The highest score is the one that's going to win. So that's important to remember. You can continually upload data. Now, I can't speak to whether your EHR vendor or your registry would charge you for multiple data submissions. I'm just saying that this particular program allows you to update your data as many times as you want until March 31st. Okay, so that's quality data. Quality data is completely different in this system than either of the other two categories. You have to upload a file. There's no attestation. There's no direct entry of numerators and denominators. If you pick the Advancing Care Information option, this is the screen that you're going to get. And you can see it gives you two choices, attestation or EHR. So you could do exactly what you did with the quality measures and upload that QRDA3 file from your EHR that contains all of your ACI information, or you could just go in and attest. You could enter your numerators and denominators yourself and attest that they are accurate. You do have to select the performance period you're covering. Does your data cover the whole year or 90 days? You have to say. And then you have to decide whether which measure set you're using, the 2015 or the 2014, because you have an option. You can either enter data directly by attestation or through the download of that QRDA3 file. Be sure to attest to all questions, including a new one, to agree to cooperation with the ONC auditing of information. One of the things that was added in the final rule, or it might have been the final rule last year, was this new verbiage where you're basically attesting that, yes, if the ONC conducts an audit, either of my practice or my EHR vendor or registry vendor, I will cooperate and provide the information necessary. This was written in to actually provide some protections to practices who do use third-party vendors to submit their data, to ensure that those vendors and those EHRs are actually meeting the CEHRT requirements and the requirements of the program. Improvement activities, you can also do either way. You can attest, or if your EHR was allowing you to collect this information somehow in the EHR, it could be part of the QRDA3 file that they download. Most people would elect to attest. Attesting works similar to the ACI. You're going to put in the period that it's covered, so when were you doing the activities, and then you can search for the activities. You're just going to basically have a checkoff box where you check off and say, yep, that's what I did, and then there's an attestation button that you have to check off on. You can either enter data directly, attestation, or upload it through that QRDA3 file. This is where you would enter that IA_CC04 or the TCPI activity measure if your EHR does not allow you to submit it that way or a registry doesn't allow you. And so that's really important. If you have the mechanism to submit your quality measures because your EHR does it for you, or you have a registry that does it for you, but they don't give you the option to attest to improvement activities, or they don't give you the option to attest to TCPI as your improvement activity, and that we see that in some of them. You can go out to this site and attest to it yourself, but you're going to have to get EIDM credentials to access this site. So there is an entire YouTube video. It lasts just about 30 minutes that goes step by step on how to use this system. It's done very nicely. The presenter talks very slowly, and he shows you the screens as he's walking through it to explain really easily how this new QPP portal works. So I definitely welcome you to go to the handout section and download this presentation so that you can grab this link and you can watch this video. Again, it's only 30 minutes long. It's well worth your time so that you can see exactly how the QPP portal works. So here are the key points on the portal. On quality measures, the QPP portal does not give you the ability to individually enter numerators and denominator data for your group or individual providers. The portal only provides a way to upload a QRDA3 formatted file into the system. Your EHR would have to provide you with this file. In essence, the QPP portal provides an avenue for end-to-end EHR reporting, therefore giving you an extra bonus point on every one of your measures. For ACI measures and improvement activity measures, the QPP portal provides you with two options to enter data. The first is attestation, where you're able to enter your own numerators and denominators and then attest to their accuracy. The second would be EHR submission. Again, you would upload that QRDA3 file that was provided from your EHR vendor. Additional points. Individual and group data submission. You can submit data for your practice as a group or for each individual eligible within your practice. When you first sign on, it asks you which way you want to go, and so you pick one, and that's the way you proceed from that point on. Even if you choose, though, one method to start, you could switch to another. All submitted data will be retained by CMS, and we will calculate using the eligible clinician score and MIPS payment adjustment that results in the higher score. So that's why I'm saying early and often. The earlier you get your data in, the earlier you can see where you stand, and if something doesn't look right, the ability to correct actual errors. And the highest score is always the one that will be used. It does give you automatic feedback and scoring. So as you enter data, you're going to see that initial MIPS performance scoring based on your submissions. And the scoring may change if you then participate in an APM, report new data, or use quality measures in the quality performance category that have not yet been benchmarked. Please do keep in mind, any benchmark that we've shared with you already, any benchmarking that's done in this system can only be based on the most current benchmarks. And those most current benchmarks are from 2016 data. The benchmarks will be recalculated with the 2017 data, so there's really no way to know what the actual benchmark will be based on the 2017 data until the 2017 data is in. It's like a chicken and an egg question. So it never changes year over year dramatically, but what could change dramatically is the non-benchmarked measures. So if right now you maybe are using a specialty measure set that doesn't have a lot of benchmarks established, the likelihood that they will have benchmarks established for 2017 is definitely there. And so the score you would see would probably be your worst case scenario score if that's what's happening to you, as opposed to your what could be the best case. You could get a better score. On the other hand, if lots of providers report data on a measure and all of a sudden the benchmarks move up, you could get slightly fewer points than you initially expected. It's only as good as the most currently available benchmarking data. Finally, continuous submission. There's no submit or save button in this system. Once you just enter it, it's just entered. It saves it as you enter it. You can update your data anytime during the submission window of January 2nd to March 31st. And once that period closes, CMS will calculate your payment based on your last submission or submission update. Okay, Valencia, you want to go with the next polling question?
Certainly. Our next question asks, I plan to use the QPP portal to report all of my MIPS measures, only my IA measures, only my ACI measures, only my quality measures. I do not plan to use the QPP portal to report any measures.
Okay, so again, Valencia, wait until we have at least 75% reporting.
Okay, sounds great. We have about 53% that's voted thus far. Looks like we're holding still at 63%.
Okay, get them in there, guys.
We're at 68% thus far.
Almost there.
Looks like we're at
okay,
70%, Cindy. Okay, we
go
just
ahead,
reached
go.
75. We just reached
great.
75. We have 47%, all of my MIPS measures, 27%, only my IA measures, 7% only my AC measures, 13% only my quality measures, and 7% don't plan to use the QPP portal to report any measures.
Okay. Great. That's a nice high percentage for all, and so I'm really excited to hear that. That is definitely something that your practice advisor is going to want to work with you on to make sure that you're set up to be successful with that. All right. So that brings us to the elusive EIDM credential. So, valid EIDM credentials are required to use the QPP portal. So, this is kind of your basic, covers many things, secure sign-on for CMS programs. You may be familiar with EIDM credentials. They would have been used before for meaningful use reporting if you were doing that yourself, for PQRS reporting, and for retrieving your QR/UR reports. So all of those things are done through the same password, if you will, or credential that is called your EIDM credential. If you have EIDM credentials because you've done that stuff in the past and you've used any of those systems, that same credential is going to work for QPP. You don't have to start a new account. You can just use your existing EIDM sign-on. If you have EIDM credentials and already have access to the Physician Quality Reporting System, the PQRS portal, you already have access to the QPP portal. Basically, they took the PQRS portal and revised it to make it the QPP portal. If you have EIDM credentials but do not already have access to PQRS portal, you'll need to request that access, but you can use the same credentials. So you're basically going to go sign into EIDM, and you're going to ask for new access to the Physician Quality Reporting portal. EIDM credentials will also be required to be able to receive and review your MIPS performance reports. So, important, and that's why it's in red. The MIPS performance report is going to replace the QR/UR report. This is your official report of how you performed compared to other practices and the information that's being used to calculate your payment adjustment for 2019. You're going to want this report. You're going to want to be able to see where you stand to benchmark yourself so that you know where you need to improve. I know that a lot of practices don't go out and get their QR/UR report because they struggle with this whole EIDM system. And sometimes it can be very frustrating. But I will tell you that if you stick with it and get through it and get your password set up, and keep it somewhere where you will never forget it. It's really not hard to use the system from that point on. And it gives you great access to both enter and review data. And so I think it's really important that all of our practices make sure that they identify someone within their practice to get EIDM credentials so that they can sign into this portal. All right. So how do you even know if someone has one? Well, if you want to determine whether your organization is already registered in EIDM, this is the phone number and email you can use. This is the QPP help desk, basically. They will be able to tell you, they can look into the system and see if someone already has EIDM credentials that are tied to your practice TIN. So you would need the group's TIN and the name of the group when you make this phone call. So they can tell you whether someone is already registered to your TIN through the EIDM. To identify who your organization's security official is, so the security official is the person who basically sets up access first and then becomes the person responsible for approving others to have access. They can also tell you that. If you don't have a security official, you need to designate one and start from scratch and create a new EIDM account, tie it to your TIN, and then that person can provide further access if that's what you want, or they could be the one person in your practice that's able to access the system and get this information. But it's really easy to either email them or call and ask, does my TIN already have someone who has access through EIDM, and who is the security official for my practice? So there are primary and secondary roles that you can request in this process. Primary roles are basically, as I said, the first person, and they're the one that's going to approve other people to do things. And they have broad authority within a practice. So groups and individuals, they have, whether it's a group or an individual, they give it different names, but it's basically the same responsibilities. If you're in a group situation, so you have a group TIN, the role is called a security officer. The role type is called a provider approver. And the privileges of this person are to approve PQRS submitter or web-based submitter role requests. In other words, approve any other requests to tie an EIDM account to your TIN. This person can submit any MIPS data on behalf of their group, either reporting as a group or for the individual clinicians. They can view all data submitted on or behalf of the group, and they can view all data submitted on behalf of clinicians in the practice. So they have full view and enter privileges, and they get to approve additional people who are allowed to enter data. If it's an individual TIN, it's not a group, it's just a single provider and they're practicing under their own TIN. It's called an individual practitioner. The role type is still provider approver, but they have similar roles, right? They can approve other people to enter data on their behalf. They can submit data on their own behalf, and they can view all submitted data that's been entered for them. So this is the lead role, if you will. It's the primary role. There are also secondary roles. So this would be, I would imagine, more for either large practices or even a small practice where you're going to delegate the data collection responsibility to someone within the practice. So let's talk about group first. In a group situation, there are two different roles that you can request. You can request for someone to be a web interface submitter, or you can have somebody be a PQRS submitter. A web interface submitter only can put data into the G-Pro web interface, that G-Pro system. A PQRS submitter can only put data into the QPP portal that we just reviewed. So the role that you choose depends on the way you're going to submit your data. If you've already signed up to be a G-Pro submitter through the CMS web interface, you would ask for someone to be a web interface submitter. If you wanted somebody to just submit through the QPP portal, because that's the way you're going to do it, you could ask for them to be a PQRS submitter. In an individual practice, it's very similar, but now we call it an individual practice representative. And they are considered a PQRS provider, and they can submit data on the QPP portal for that clinician. So they can view data and they can enter data, but they can't approve other people to be able to do the same thing. Please note that for both of these, an organization has to have a security official before they can ask for any of these secondary roles, because these can't be approved unless you have a security official already designated to approve them. So what do you need to establish this credential? Well, if a user is going to request a security official role, this is what you're going to need. And I strongly recommend that you gather all of this information before you go into the site to start entering your information to apply for your credential. You're going to need your group's Medicare billing TIN, the legal business name of the practice, the NPIs for 2 rendering physicians or clinicians, who bill under the TIN, their corresponding PTAN, provider transaction access numbers. So basically, in order to prove that you know what you're talking about when you're trying to tie this practice to your credential, they're going to ask you for information that only someone within the practice would be able to know. And so that information includes the TIN of the practice, the legal business name of the practice, and then both the NPIs and the PTANs for 2 practitioners who bill under that TIN. So you've got to gather that information first. You're also going to need the organization's address, city, state, zip, and phone number. They are going to want the zip +4. If you don't know the +4, pick up a piece of mail that came in recently and look at your address. You'll be able to see what the +4 was that was added to that zip code. If you're going to be requesting individual practitioner roles, so this is for an individual practice, you need the clinician's name, the clinician's TIN, the legal business name they bill under, their rendering NPI and PTAN number, and the address, including zip +4 and phone number. I will also tell you that if you've never gone on into EIDM and set up a credential before, you're going to be asked to set up a username and a password. I don't believe you can just use your email. You might be able to just use your email as a username, but you have to set up a username and password. The password's pretty specific. It has to have capitals and smalls and numbers and symbols. It cannot be a dictionary word, I believe, is one of the rejections that I got when working with the practice. And they're going to ask you questions to try to validate your identity. So you need to enter in your name and your birth date, a home address, not your business address, and your social security number is optional. You don't have to provide the social. But what they're going to do with that information is basically go out and look into pretty much the databases that are used when you go to get a credit card, and they're looking you up to do a background check. And then they're going to present you with a series of questions that ask you about you. So where was the last address you lived before the one you live at now? Or, you may or may not have opened a mortgage account with one of the following banks in 1986, and then you have to pick which one. Again, it's security. They're trying to validate that you are who you say you are, because they're about to tie some physician's practice to your EIDM credential. So they want to be able to have that audit trail to show they gave out the credential correctly and that it is being given to a person who they can find if they find out that it was inappropriately assigned. Users requesting the PQRS submitter, web interface submitter, or individual practitioner representative roles. So these are just your secondary people who are just going to enter data. What they're going to need is the group's Medicare billing TIN, the legal business name, and the address. The security official or individual practitioner will then approve these requests. So you need less information for this one because these aren't going to get approved unless the security official says that they can be approved. So how do you do this? It's not necessarily the most intuitive system or user-friendly, if you will. But we have good resources for you to use, and we have help to provide. The first thing is, this is the address that you're going to go to, portal.cms.gov. And what will be displayed is the CMS Enterprise Portal, and you're going to select the new user registration. From that point, you're going to follow the detailed steps in the EIDM user guide starting at page 13. And where do you find the EIDM user guide? It is in your handouts on the control bar for this webinar. So the same place that you're going to pull down these PowerPoint slides, you can go pull down the EIDM user guide. Please, please, please pull that down so that you can use it starting at page 13 to navigate through this process. Go ahead, Valencia. Why don't you launch that next question?
Okay. This states, select the statement that best describes your situation. A, I have EIDM credentials and know how to access CMS applications like QPP. I have EIDM credentials but will need to request QPP application access. I do not have EIDM credentials and will follow the EIDM guide to obtain them. D, I do not have EIDM credentials and would like assistance from my practice advisor. E, I do not plan to obtain EIDM credentials. So we have 47% voted thus far.
Okay, so keep them coming, guys. We want to get to that 75% again.
We're about at 58%, 63%. We're looking at 0 for I do not plan to obtain EIDM credentials.
Okay.
So it looks like we're holding still at 63%, Cindy, with 33%.
Okay, go ahead.
33%, I have EIDM credentials and know how to access QPP. 42%, I have EIDM credentials but will need to request QPP access. 17%, I do not have EIDM credentials and will use the EIDM guide to obtain them. And 8%, I do not have EIDM credentials and I need help from my practice advisor.
Okay. Well, we will follow up with each and every one of you to help with that, help you to get on, especially those of you who said that you would like help, because we definitely want to get you through this process. And again, I'll just repeat, I know it's frustrating. I've helped a couple practices get on, and we've hit little bumps here and there where we didn't quite have the right information. But, you know, once we got it, getting into the system and being able to run the QRUR report or run the performance report or access this data entry is very easy. The hardest part is setting up the password and credentials. So let's get you through that, and then you'll just have that, and you'll be able to use that going forward year after year. So if you would, if there are any questions, I know we're right up against the hour, but we have about 5 minutes. If you either want to put a question in the question or chat box, or raise your hand by clicking next to your name on the little hand icon next to your name in the attendee list, we would certainly be happy to answer questions. I did put up on the screen, just so you can see it, that there are some additional webinars being done on this nationally by CMS. There's one on MIPS data submission on the 23rd and the 25th. It's the same one, but it's offered 2 different days. MIPS reporting for the 2017 performance year, also on the 23rd. And then year 2 of the quality payment program. So if you download the slides, you will be able to register using those links. The red text at the top tells you how to do that. Click on register here, select open, hyperlink from the drop-down menu.
Cindy, it looks as though we have a question from Tina Griffin. Tina,
okay.
If you'd like to speak now, I've unmuted your line. Tina, are you there?
Tina, We can't hear you, Tina, if you're talking. Tina, is your phone on mute?
I'm not sure, Cindy, but I do have a question popping up here in the box.
Okay.
They did not have to pick two options. Okay, that's just someone, okay, they were stating that they didn't have an option to choose when we did the polling. I'm not sure what's going on with Tina, but I did unmute her line. I'll check for her question in the chat box for the questions.
Okay.
Box. I don't see any other questions at this time.
Okay. So I have up on the screen now our contact list. We've done some updates to our contact list. So again, I would want you to download so that you can have that information available to you. Certainly, if you have any questions following this, and Tina, by all means, follow up with us on email. I know you and I talked last week, and you've been talking to Amanda, so we're going to try to get you all squared away here because you have a tight deadline. By all means, reach out to your practice advisor. Let them know that you need them to come in and that you need some help. And please do, I'm going to leave this up. So, Valencia, I don't want you to close the meeting out. Leave it up for a little longer just so people can download those handouts if they haven't had the opportunity already, because I think they're both very important for you to have moving forward. So that being said, I think that we will just, I'm going to mute the lines and just leave the meeting open again so that people can download. I thank you guys for joining us, and I look forward to talking with all of you again very soon. So long.